Hello, my name is Jared. I am the primary technical support here at Miracle Software. And today through this recording, we'll be going over a brief demonstration of the Medisoft clinical software. We'll kind of look at the main dashboard. We'll go through a patient's chart and see how that data can be entered into that. We'll briefly touch on some of the progress notes, SOAP notes, as some of you may call them, to enter in some of your clinical notes. We'll kind of discuss a few features of those notes, how they can be very powerful and push and pull data from other areas of the patient's chart. And we'll discuss some of the meaningful use information towards the end as well, and extra features and add-ons for the Medisoft clinical software. To begin with, though, you'll see the software here. You'll see it's also branded as Practice Partner. So it can be called Medisoft Clinical. It's the same thing, just kind of a rebranding. I'll log on in here, though, and kind of show you around. So when you log on in, we have it set right now to display the dashboard. Some of the things that you'll notice right away up at the top is a schedule. Currently has no patients in it since this is demonstration data. But if you use office hours in accord with the Medisoft practice management software, your office hours appointments would be brought right over into this schedule here on the dashboard. Some other information that you would also have quickly at your disposal here is internal messaging. You'll see that we have the ability to give messages and send messages to other staff in the clinic. It could be business related or something else related that you want to designate this for. And we can reply and forward, create new messages and things like that to others. If we create a new message and set the priority to 9, what's really nice is on the lot when that other person who this message is intended for, when they log into clinical, up at the top, they're going to see this message button glow in red. And so they'll definitely see that that is an important high priority item for them to attend to, essentially. Something else in the dashboard is the lab review area. The clinical program does have the ability to talk digitally with laboratories. That is a connection that does need to be established, but if you work with labs and other things like that, that's something we can tie into. Also up to the top right box here, we have a to-do area that allows a provider or staff member to set things kind of as a reminder to themselves, things that they need to complete. And you can basically set some various things like that here, active date, expiration date, how often this should occur, and other things like that, just as a nice reminder for yourself. At the bottom here, we also have a note review area, and it would show up just like a line just like these other boxes do. But that's intended for if you have a staff member filling out notes, like a SOAP note or a clinical note in behalf of the doctor, but needs the doctor to review and sign the note once it's complete. So a doctor could easily enough pull that up and sign off on that by entering in a secure password. We'll pull up a patient chart here just to get an idea of how that looks like and how we can enter in data there. We'll just take our first patient here, Randy, and we'll pull up his chart. We'll get into some of the information here behind it, but you'll see the thing that we have pop up here first is a very huge benefit to patients. This is something called health maintenance reminders, and I'm just going to open this up. What we have here, though, health maintenance allows us to keep track of certain things that we feel that the patient needs to be checked up on at a certain interval. So maybe it's every time they come in, every week or month, or how often we designate that for. We could see this is kind of configured for a medical clinic, but if we were a chiropractic office or physical therapy, something else, we could completely configure this to meet our needs of our patients and really provide them with the best consistent care and get those pop-ups if they're overdue for anything that we feel is necessary. We'll go back to our main chart here, and you'll kind of see the visual layout is really intended to be nice and well recognized by a doctor. They tried to design it so it's as if you're looking at a paper chart. We have various chart tabs here that list what's essentially under that chart tab. You'll also notice these little blue indicator lights, and some chart tabs have them while others don't. The ones that do have them signify that there is data behind those chart tabs. So it's an easy visual indicator for us to see which kind of tab and category has information behind them. Why don't we go open some of these here. We'll open up the problem lists. Now, a lot of these various chart tabs, including the problem lists here, can be manually have data entered into them. For example, like this one here, we have back pain in the major problems area. We could come down here and hit new and add in a new major problem. We also see we could do that the same thing for other problems, procedures, diagnoses, and so on. So that's a manual way you could come in here and enter that. Usually we recommend that that's more of a viewing area only. This clinical program has something called Bright Note technology, and that allows the provider to really, instead of spending a lot of time going to each of these tabs and entering data all of the time, really they've designed it so that a provider can come in and actually create what is called a progress note or SOAP note or whatever you want to call it. All the data is actually entered in through that note there, and then once they save that note, that data gets pushed out to other areas of the patient chart. For example, if they were to save a progress note stating various problems that the patient was in for, medications they should have, vital signs, things like that, it can be saved in a way where that information, once the note is complete, will be actually pushed out to the problem lists, procedures performed, and so on. So we'll show you an example of that later. Why don't we go in here and we'll also look at, we've already looked at health maintenance and problem lists. Prescription and medications here. We have the ability, if your clinic does prescribe medications, this would be something of use to you, has the ability to do e-prescriptions, and printing those out keeps track of drug-to-drug interactions, and of course looks for any sort of issues with allergies and things like that. So we can enter all of that information as far as the allergies up top, add on and remove. We also have the ability down here to see a kind of a time history of various prescribed medications, ones that we've deemed ineffective, and kind of a historical list of ones that they're no longer on. So it's really simple though. If we wanted to come down here, fill out a new medication for this patient, we could simply look up through the various formularies that come with the software and are downloaded and updated really constantly. But we have the ability to scroll through here. We could type in a nice keyword and bring us right to the various things that we'd be looking for. And we could print that out here locally. We could send that electronically, and so on. Of course, if we ever have any sort of adverse reactions or potential adverse reactions, they may give us a nice little warning here for us. This penicillin was added in manually, so it can't really tell what that is, just allowing us to see if that may have an adverse reaction. We're not going to print that now, of course. What's also nice is we can apply some of the built-in health maintenance features that come with the system, allow us to add this protocol to one of the health maintenance templates if we wanted to put them on that. And we don't really want to worry about that right now. We're able to print the medications and prescription lists right here from Clinical. Of course, we're going to skip that for our demo today. Why don't we go in, though, and see how a patient note is constructed. We'll look at some of the recent ones that have been done. And they can really range from very basic to quite complex, using various coding and quick text and things like that, which we'll get into here soon. As you can see, some of the past notes we have here seem to be pretty basic. Some use these dot codes, as we call them. It'll say .al or .k. These dot codes are essentially what pushes out that information from the note into really the problem lists or the medication lists, allergy lists. So you can see here if we were to create a note and put in the dot code AL, it would actually push this new allergy that this patient has, penicillin, to the allergies list. Again, that Bright Note technology that allows everything to be centralized through the note-taking process, and that flows out to the patient's chart. Why don't we go through here and we'll create one for you just to give you an idea. Now there's three main ways we can actually create and enter in notes into the system. We could simply type out a note as we wanted to. That's doable, but really the software allows you to do a lot more. It does work very well with the Dragon Naturally Speaking software. As an add-on, you can install that and essentially speak your notes right into the system. And not only that, the people at Dragon actually designed their Dragon Medical with Medisoft Clinical in mind. And so there's a lot of actual program control. If you say exit or close, it'll actually close and navigate throughout the system, the menus and things like that of the software as well, allowing you to work hands-free a lot of the time if you're using a touchscreen laptop or something to that effect. So we have those two ways, and the last very powerful way is called through some of the built-in templates into the system here. A lot of these come pre-installed to really work with special practices. So if you're a chiropractor, they have a special set of chiropractic templates. And many other practices, they have very specialty templates to work with, what you would most likely use. We'll open up a back pain template here and show you kind of how that works. So these templates, before we get too much into them, are completely configurable. So often clinics will have a paper notating that they take right now, and they want to have that mimicked in a digital form. And we can do that. So if you have a paper, you really like what you're already doing in paper, we can actually build a template for you. It's very easy, and have the various things that you would fill out on paper in a digital form here and go through it really quickly. What's also nice is these built-in ones that come into the system, we can keep what we want and delete other things that we don't need. We can completely create our own templates to match whatever the clinic needs, and you'll see how this goes really quickly here. So these templates use what is called quick text. And there's a couple versions of quick text. You'll see that there's some red text and some blue text, and that's our primary quick text. What's nice is the red text acts as a pick list that allows us to choose a certain set of different things from a list here. Pretty straightforward. And then that helps us to fill in the sentence. In this case, I'm going to insert, well, this 55-year-old male presents with 3 to 5 days of back pain, or we could say a chronic history of back pain. You'll notice I just clicked on that blue quick text, and that essentially, when I click on that, it tends to just simply insert what that blue text says. Sometimes, as you'll see down here below, it'll also expand into a whole subset of extra information. Before we get too much further, you'll see that what happens if I skip some information in the note that I don't want to fill out, it actually turns it gray. And this is a really nice feature because it keeps our notes very concise and condensed. When I go to save this note, it's only going to keep the information that is in color or in black text. Anything that's been grayed out that I've skipped over, I don't feel is necessary, is going to be removed from the final note during saving. So that'll keep a very nice, concise note. Some clinics then, what they'll do is make a master note for everything in every sort of situation that they could have for a patient and fill out only the needed areas of that note. Thus, when they save it, they only have the information on that note that they need. But anyways, we'll go through this note and kind of just show you how quickly we can fill it out. Simply, we're able to click and select the information we need very fast. You can see how this would work really well if you have like a tablet computer, an iPad, or something like that. So we'll just kind of go through here, and I'm just going to fill out just a few more other details here. come back down to the bottom. Here we can see that one of the blue quick text that I click, actually when I click it, it turns into a diagnostic code. And we'll see how this gets actually flowed back into the procedure and diagnostic code lists that we'll see back in the patient's chart. So again, we'll see how this really flows nice and easily to other areas of the patient's chart. And the same thing with down here. Once I'm all finished and I've completed my note, I can hit OK up at the top, and it'll ask if I'm permanently done. Because of the way I filled out the note, you may recall there were some green little markers at the end of most of those lines. And they call that E&M coding, and that stands for Evaluation and Management Coding. That's a major benefit to clinics because many undercode for their services, for their office visit codes. And so with these various templates that we have here, they've been developed by other chiropractors, other doctors that are out there. So when we fill them out completely, this software can automatically determine, based upon our answers to some of those questions, what office visit level we should charge. In this case, I didn't fill out the whole note, but it still suggested a 99213. I'm just going to say OK. Then, of course, I can either hit cancel at this point to leave the note in a saved status, but still needing to be reviewed by the provider, or I can go through and say, yes, I'm the provider. I'm going to sign off on that. We'll take a look at what our note looks like once I'm done here. Here's the completed note. We see it's a lot shorter, and it only has the pure information saved. Now you may look at this and say that it looks a little like it could use a few other tweaks to it. We can also add graphics to this, charts, graphs, logos, or kind of company headers, pictures, and things like that if you want to really spice up your notes. So completely configurable, and we'll get into that in a minute here. At the bottom of the note here, you also see that it shows a signed by and also gives the date and time stamp for us to reference. Let's go and we'll actually see how that information flowed over to our problem list area. If we go into other problems, we'll see that this information flowed right on over for our office visit here. And our diagnoses code of low back pain was just added here. So I didn't have to come in here and spend all that time. It was just a clickable entry on that note, and it flows into other areas. Once we have a progress note that's been filled out and has at least a diagnostic code and a procedure code on it, we can then create what's called an electronic encounter form and send that out on over to the Medisoft billing side of things. I simply pull it up in here and then post it to that patient's account. It's ready to go out immediately. Now, that's the main information and things that we would go over for Medisoft Clinical. There's a lot of extra features that will work and be definitely beneficial to many clinics, so we can certainly go over those features if you have more questions. Some questions we often get is if it's going to work with an iPad or some sort of mobile tablet, and we can configure the software to work well with that through remoting on from your tablet to a server computer that's running the clinical software. And you can ask us for more information on that. There's also some other add-ons that allow your patients to be able to see their clinical chart information from home by logging into a secure website. It's something called WebView. And as I mentioned before, we can get other sort of add-ons like Dragon Naturally Speaking and things like that that help make your entry a lot easier. If you have any other questions, feel free to let us know. Again, my name is Jared, and our number here is 877-252-2949. Thanks a lot and have a great day.